Hello everybody and welcome to the Thursday edition of Video Clips. Robert Barrison is a psychiatrist in private practice in Lexington, Massachusetts, and he's the author of a book called Psychotherapy of Character. On his website he writes that he is, quote, troubled by the rapid and tragic degeneration of the field of psychiatry and also by the fact that patients no longer receive proper care since, quote, contemporary psychiatry has fallen under the sway of biological psychiatry. So he's one of our people. I've never met him before, but when I started reading about him, I knew he had the right idea. He says that the idea that human suffering is a brain problem is a misguided belief and laments the fact that current thinking is that emotions and psychological state are a result of the mechanical action of neurons and that people who are depressed and anxious are victims of a faulty machine, a brain that just doesn't work right. But he has another unique perspective on the relationship between psychological problems and the brain's biology that I think is worth talking about. In a recent article posted on Medscape, he states that the brain's operations are indeed biological. As humans go through life, the brain forms complex neuronal connections that form consciousness and maps emotional experiences through cortical memory. For example, deprivation and abuse can lead to depression, anxiety, phobias, hyperactivity, obsessions, compulsions, or psychosis, depending on a person's temperament. Dr. Barrison likens the mapping of these emotional responses in the brain to the mapping that takes place if you decide to do something like learning to play the guitar. You can learn to play the guitar incorrectly, for example, playing with a scrunched up hand position. And so you don't really produce very wonderful music. But at some point in time, this can be corrected by being shown how to stop using the incorrect position and then paying a lot of conscious attention to changing the way that you're holding your hand in a different position while you play. It can feel really clumsy and frustrating at first, but eventually a new and different neuromuscular map is established and playing the guitar correctly becomes the default setting and it isn't so much work anymore. Well, in the same way, the brain can be rewired in response to changing thought patterns and different life experiences and the learning of new emotional responses. The purpose of psychotherapy is to help people to deactivate the maladaptive brain mappings, similar to learning how to discontinue holding the guitar in the wrong position, and then forge new and more constructive pathways in the brain, like learning how to play the guitar the right way. And so you repair the damage resulting from previous negative experiences, thoughts, and emotions. Thus, Dr. Barrison says, psychotherapy really is the ultimate biological treatment, deactivating neuronal mappings that underlie emotional responses that are just no longer desirable or useful to the individual and replacing them with newer and better ones. And let's face it, it's a whole lot safer than drugs, it's much more effective in the long term, and side effects include happiness and better relationships, which is a whole lot better than what you get with the drugs. So I really wanted to share this with you because we've always said that the types of problems that get people in trouble with their emotions and life in general is they're not biological misfiring of the brain where you have a defective brain that has to be medicated. Having said that, there is a biological origin for everything, but it is the mind controlling the brain, not the brain controlling the mind. And that's a simple statement, but it has such profound implications. So if you have developed a lot of mapping in your brain that has caused you to have a very miserable life right now for whatever reason, you can draw new maps. Sometimes you just need to be shown how. And that's done with people who know how to do talk therapy, not by giving people drugs. So anyway, like this guy, Robert Barrison, he has a great website, a lot of good stuff to read on it if you want to look into that further. All right, I'm getting a lot of questions about this stool test called Cologuard. It's a test that uses a person's DNA rather than blood to screen for colon cancer. It was approved by the FDA in 2014, and it's currently included in the American Cancer Society's colon cancer screening guidelines. The product is made by a company called Exact Sciences. It's available by prescription only, and it costs $599. Now, one of the reasons why these types of colon cancer screening tests are gaining a lot of popularity is because people just hate colonoscopies. And there's a good reason to not like them. They're not very effective, which I'll come back to. And there also is a great amount of risk associated with colonoscopies, so people are looking for options. Well, I want to tell you what the company's website says. This was very interesting to me. So I went to their website, and it says, quote, Cologuard is not for everyone and is not a replacement for diagnostic surveillance colonoscopy or surveillance colonoscopy in high-risk individuals. False positives and false negatives do occur. Any positive test result should be followed by a diagnostic colonoscopy. Following a negative result, patients should continue participating in a screening program with a method appropriate for the individual patient. Cologuard performance when used for repeat testing has not been evaluated or established. And so I find it curious that the test is being embraced by medical professionals and offered by institutions like Mayo Clinic, because I don't know how you took that paragraph, but it seems to me like all roads lead to colonoscopy. Well, anyway, Mayo, this is what the chair of the Mayo Clinic Gastroenterology Department has to say. Cologuard represents a significant advancement in identifying colorectal cancer at its most treatable stage. We believe offering this new tool will promote patient and community public health and may move more patients to get screened earlier, a critical step in beating this prevalent and preventable cancer. So this is a screening test that leads people to get a screening test, is what it sounds like the guy from Mayo is saying. Well, I think that a lot of enthusiasm about this test has been quite premature and unwarranted. In fact, the company acknowledges that the test results in false positives and false negatives, and in the trial that they submitted to the FDA for approval, 13% of people were incorrectly diagnosed as potentially having cancerous polyps. Now, to put that in perspective, the error rate for blood-based stool tests is about 5%, so you're talking about almost 3 times higher rate of false positive. A concerning factor is the recommendation to have a colonoscopy in response to a positive test, and those who have a negative test are supposed to continue testing with some other method. So what exactly is the value of this test? Well, experts provide some interesting answers to this question. I went online to see what some other people had to say about it. Dr. Joel Levine, who's chief of gastroenterology at Columbia University Medical Center, says that the false positives could be concerning, but the concerns can be addressed with more definitive colonoscopy tests. Dr. Bennett Roth, professor of gastroenterology at UCLA, says that the biggest benefit from the test is that it can encourage more people to have a colonoscopy, which he refers to as the gold standard for diagnosing colon cancer. He says, quote, it doesn't replace the need for a colonoscopy. Kevin Conroy, CEO of Exact Sciences, who makes and markets this product, agrees and states that the company's goal is to increase the screening pool of people who have colonoscopy. Well, to summarize, the test is expensive. It's $599. Do you know how much a blood stool test costs? $25, all right? Its main purpose is to herd more people into having a colonoscopy, which is encouraged whether the test results are negative or positive. And I find this interesting because, as I said earlier, the main reason why people are looking for alternatives like this is because they want to avoid the colonoscopy. And you might be thinking, why would anybody want to avoid a colonoscopy? Well, it's invasive, it involves risk, and it's an ineffective population screening tool. So in 2016, the Canadian Task Force on Preventive Healthcare updated its recommendations for colon cancer screening. The task force says it does not recommend using colonoscopy as a primary screening test for colorectal cancer due to lack of evidence. In fact, not one randomized controlled trial has ever shown that colonoscopy reduces the risk of dying of colon cancer. Serious complications occur in 5 out of every 1,000 procedures, and perforation occurs in 1 out of every 1,000. Most important, however, is that 1,250 people have to have a colonoscopy in order to save 1 life, and for every life saved, 1 person is harmed or dies from complication of the procedure. So you kill 1, save 1. The recommendation of useless tests like Cologuard in order to generate more prospects for more useless testing does not improve health. It just inflates the ridiculously high healthcare bill we have right now. I mean, I'm just astounded that this thing is gaining any traction at all. Now, if you're looking for a better alternative, which a lot of people are after they hear all of this, the FIT test is a much more effective alternative. It's a home stool test that requires no liquids to clean out the colon, no sedatives, no anesthesia, and almost no risk. It's effective in diagnosing 79% of colorectal cancers. One meta-analysis of 19 studies shows that FIT detects almost 4 in 5 cancers with a single test. The researchers concluded, quote, this systematic review and meta-analysis suggests that FITs have high accuracy, high specificity, and moderately high sensitivity for detection of colorectal cancer. So my recommendation is to say no to this Cologuard, say no to the colonoscopy. Colonoscopy has some value for very specific diagnostic purposes. As a screening tool, it's awful. A screening tool that herds people into a bad screening tool is a bad idea, in addition to being expensive. So I think if you're going to do something, do the fit test and don't get sucked into this Cologuard situation. One thing I couldn't find out is what percentage of that $5.99 most insurance companies are paying. If they're forced to pay for it, that would encourage a lot more people to do it. But I wouldn't take it, and I would suggest that you think strongly about it for a long time before you consent to it as well. All right, that's all for today and for the week. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you next week with more news.